Good afternoon. I'm Dr. Andrew Freeman, and I'm here at ACC 13 in San Francisco. I'm joined today by Dr. Timothy Bateman and Dr. Andrew Einstein to talk a little bit about patient-centered imaging for the patient-centered care community on CardioSource. Good afternoon, gentlemen. Today we're going to talk a little bit about what you guys have been doing and why it's so important. So tell us a little bit about what patient-centered imaging is.
Good afternoon, Andrew. It's great to be here with CardioSource. Patient-centered imaging is all about performing the right test for the right patient at the right time and using the right technique. This can mean many things depending on the clinical context, depending on the modality, but it involves choosing the right test or performing no test if no test is indicated. And when choosing that test, protocoling it in such a way that the benefits of the imaging are maximized and the risks associated with the imaging are minimized to optimize that balance.
I think that's fantastic. So tell us a little bit about what you might do to reduce the dose or do something in a way that would be safer for a patient.
Sure. Well, there are many different types of patients that present for myocardial perfusion imaging. Some of them have very simple clinical questions that need to be answered, and some have very complicated questions. And in the current era, we no longer do the same test for the same patient all of the time. So if the clinical question is relatively simple, we will use ideally the most optimized camera that will allow us to use micro dosages of tracer and do stress-only imaging to get that answer. And if it's a more complicated patient, we'll again try to minimize the radiation exposure, in our case by selecting PET over SPECT for perfusion imaging.
Great. And so when you talk to patients about the imaging test that they might undergo, what's their response? How do they react to that?
Well, it depends on the type of test, but I think good physician-patient communication is really essential, and explaining what the clinical question is in layman's terms and explaining how the test which we're going to be performing is the best way to answer that question is really crucial.
Okay, and any other comments?
Sure, the new developments in myocardial perfusion imaging also entail much faster throughput. So a stress-only study, for example, is about a 30-minute deal for the patient. So do they like that? Yes, they sure do. And likewise, a full rest-stress PET study can be done easily within an hour. So those old days of a patient sitting around a lab for perhaps 6 or 7 hours to get the rest and the stress done are over for most patients.
Great. And then maybe we'll close a little bit. Perhaps you can give us an idea of what a typical non-obese individual's dose might be, say, for a standard nuclear stress test.
Well, as we have tried to suggest here, there is no standard test anymore. So if that patient is moderately obese and can exercise, that patient in our lab would get 4 millicuries of technetium, which is about 1 millisievert of radiation exposure.
And that's fantastic. I mean, back in the days of where I trained, and I'm not that far out, I mean, it's a tremendous reduction. So I think both of what you guys are doing is absolutely fantastic and clearly gives insight that the future of technology is changing, the future of medicine is changing, and we're finally putting our patient-centeredness to use and saving radiation and other testing that's unnecessary for patients. So thank you for joining me today. Appreciate it.
Thank you. You're very welcome. Great to be here.